The focus of the ministry has shifted from a national sickness service, which treats disease, to that of a national preventative or primary care health service, which emphasizes promoting and protecting health and preventing sickness by providing the best quality care.
Barbados is one of the first Caribbean islands to have a fully functioning chronic non-communicable disease commission. It works. We have great men and women on that commission that has been advising the ministry. I believe they were the first to come up with a strategic plan to address the issue of chronic non-communicable diseases. I can't say to you that about 65% of our healthcare budget is being spent on chronic non-communicable diseases and just go back and ask taxpayers to give us more money, when by and large these are healthcare challenges that relate to the one's lifestyle. It is easier for us to address those lifestyle-related issues than to care for someone in an acute care setting. And that is why I commend the work of the Chronic Non-Communicable Disease Commission. With their advice, assistance, and cooperation, we've got a national exercise task force that has started to initiate in people's mind the importance of exercise and healthy living, which will continue. I'm so proud when I see young people and old people now going to dancing lessons. When I see them walking on the street as I walk on mornings sometimes, or going to the beach. This is what we want to encourage in this society, for people to get up and get active, rather than just become couch potatoes. We also, coming to that commission, have addressed the issue of salt reduction. You can't say to me, as one not trained in medicine, that hypertension is one of the major healthcare challenges, and the using of salt is one of the major underlying factors, and then don't address the fundamental issue. So therefore, we started a salt reduction initiative. We've talked to the private supermarket owners who've come on board with us. I think Super Scientist must be commended in that respect. We see ads running on television now about salt reduction, the harmful effect of too much salt in this society. So I think that in itself is great. We also, through the National Nutrition Center of the Ministry of Health, provided dietary guidelines for young people in schools, primary school setting in particular. We need to go out there and reach these young kids. We can't wait to say that Barbados has a problem with childhood obesity, or we have a high prevalence rate of diabetes, or continue to say we're the amputation capital of the world, and not try to deal with the young people who are at risk. So I really commend the officers for their work in terms of providing dietary guidelines to young people in particular. I've also seen the advice given to the canteen operators at secondary schools. You know, the fact that you can produce healthy food that need not be expensive. And when coupled with exercise in the school system and whatnot, we realize that in a few years we can really have a genuinely healthy society without having to break the treasury. If we continue to spend all of our money on the curative side of healthcare, we become a very sick society, health-wise and financially. And that is not the kind of society that I wish to grow up in, or wish for my children or your children to grow up in. I think we can do much better than we have done in the past.
Well aware of the need for refurbishment of what may be considered an aged plan, the ministry is also trying wherever possible to improve the conditions of public health workers.
We are certainly at the Geriatric Hospital about to open a new kitchen facility. At the Psychiatric Hospital, there's been a bad state for many, many years. Approval was recently granted to get started on a new kitchen and admin facility over there at that facility as well. Work has been ongoing at all of our district hospitals. This in Lucy District Hospital. I'm so proud of the work done there. It took a long time and cost quite a bit of money, but the fact that they have a nice, comfortable, renovated building to functioning. Elaine's Canterbury Home in St. Andrew, where we house children that are physically and mentally challenged. We're relocating them to St. Lucie in the facility that we're doing up there for them.
On another front, Minister Inniss revealed that though government would not be moving to take over the St. Joseph Hospital, a private entity closed since the 1990s, the intention was for the building to be used for medical tourism.
It's hard for people to say, put it back and use as a hospital. I don't subscribe to that view. The hospital is more than a building. It's the systems that function therein. It's the people that work therein. I am not of the view that the state can afford to establish and maintain another hospital. I don't think it is necessary. With all the highways and roads that we have, there should be no issue of access to the QEH or any healthcare facility. Morris Barr Polyclinic in the north is doing well, Black Rock Polyclinic, etc. So I never subscribe to the view that the state has had to reopen St. George Hospital as a state-funded facility. However, having made that policy decision to embark upon the area of medical tourism, we thought it would be useful and provide a good opportunity if investors, local or foreign, or combination, could take over the physical facility there and put it into use as a healthcare facility, preferably focus on medical tourism, where you can bring in individuals from abroad, both clinicians and patients, treat them here in Barbados, and earn much needed foreign exchange, boost your reputation, and also provide to physicians and nurses and other staff in Barbados the opportunity to get further training and expertise, and also for those Barbadians who need it, the opportunity to have another option as opposed to going abroad. And the cabinet decided to engage Invest Barbados to go there with an RFP and find investors, potential investors. And they did do quite some work locally, regionally, and internationally, and were able to find a North American-based group that has expressed interest in a very serious way so far in that facility. And I'm eagerly looking forward to soon having a memorandum of understanding between the government of Barbados and the group, and to see some work started in that area out there.
Work on the St. John Polyclinic is also ongoing, and on completion, it will be a multi-purpose facility, key to augmenting the healthcare system.
The failure to have completed that polyclinic has put pressure on all the other polyclinics around the island. So people from St. John, quite a number are seen at the St. John Outpatient Clinic. I really have to commend the staff. I may have been there several times and see the numbers and see how they operate in a small facility like that. And their numbers have increased, but they're limited in terms of what they can do at the outpatient clinic. So it means now that the Glebe Polyclinic down the hill is having to face the pressure. And there's some of their catchment area, people now may have to go down to Warrens, Vincent Scott Polyclinic, Black Rock. Some who go Black Rock before now have to go out to Morris Barr. Some people say the St. John catchment area by and large is covered by the St. Philip Polyclinic. And St. Philip has been one of the fastest growing parishes in its own right. So you can imagine the additional pressure placed on St. Philip Polyclinic. And then St. Philip catchment area, some of those people may have very well now found their way onto around the Phillips Polyclinic and all these things, which also is part of a fastly growing parish. And some of those now from that area now found their way onto the Edgar Cochrane Polyclinic in Wildy, which with all the large number of businesses there is part of the UWA family practice, etc. So you realize that there's a trigger effect through the entire society. And yes, we are finding ways of accommodating the numbers. But for me, it's not the quantity, it's also the quality. And the decision has been taken in this ministry that we would have brought back in the professionals who worked on the project before, take a look at the physical building, determine what is salvageable. We also looked at what is necessary in a modern polyclinic in Barbados. Bear in mind, a lot has transpired since that was designed over 20 years ago. Prevalence rate for illnesses, etc. And we decided, therefore, to have a multi-purpose facility. A healthcare facility, first and foremost, where you can provide maternal health care, mental health care, HIV/AIDS counseling, for example, family planning services, the paramedical services, ambulance service, for example, a whole range of healthcare services to be provided in that facility. And then going beyond that, to include environmental health officers and their department, welfare constituency council, which was in existence back then, as well as a gym. We want Barbadians to have the opportunity to come and use these facilities, and a state-of-the-art library. So it's much more than a healthcare facility. We're really talking about a community center that is healthcare based or centered around healthcare by providing a wide range of services to the community.
The Ministry of Health is moving urgently to improve upon the regulations for healthcare practitioners in the public and private sectors. This through amendments to the Medical Registration Bill.
When it was drawn to my attention, we quickly engaged the stakeholders, not just the Medical Council. BAMP in the wider sense was also consulted on the matter. The patients were also consulted. Because the legal fraternity, we consulted far and wide on the matter and brought to the table what we consider to be a 21st century medical professions bill. And I think a couple of things that jump out right away from that new bill, which I hope will soon be coming out to Parliament, has gone through the lower house and the upper house, and that would be the Governor General and then to be gazetted, etc., would be the issue of a specialist register. Everybody in Barbados now who is a doctor is pretty much registered as a general practitioner, a GP. Yes, we have OB/GYN specialists, gerontologists, various kind of surgeons around the island. And people know of them because people say that you are a surgeon, you are a cardiologist, you're whatever you are. What we decided to do is to go a step further. We want to have a specialist register where if you are a specialist in the field of medicine, any aspect of medicine, that you should so be appropriately registered. You must evidence that you have the qualifications to practice in the subspecialty that you claim to be trained in. And not just academic qualification, but also the practical experience. This is extremely important, and two scores. One, I think it protects the medical profession on the whole, that you don't get people masquerading and perhaps then having adverse incidents, etc., that then tarnish the reputation of doctors in Barbados on the whole. I don't think that is fair to the medical profession. And secondly, also of great importance, is its impact upon the patients, or potential patients. I think people who are going to a specialist ought to have a right to know what to expect from that specialist. What kind of skills that person has, and more importantly, to just know that the person is indeed qualified to do the things that they're supposed to be doing.
Minister of Health, Donville Inniss, as he gave an update on the work of that ministry and the changes being carried out to ensure the sustainability of the island's healthcare system.